A certain woman waited for 13 years before she was able to conceive. At the end of the day, she conceived and she carried a set of twins. Pregnancy wasn't stressful, funny enough. At the end of the day, pregnancy got to term and she delivered this set of twins. Well, it was in the rural area, so delivery was even at home. 3 days after she delivered, before the naming ceremony of a beautiful set of twins, a boy and a girl, she woke up one morning, carried the 2 children, and dumped them inside a well. Of course, luck didn't shine on their faces. They died. In the village, what do you think now? They will say she's a witch. There is something called maternal blues or postpartum blues or baby blues or maternal depression, and it is very, very, very real. Some women will have it after they deliver. It means that just following delivery, we have some degree of psychological instability, emotional disturbance, everything that comes with something that looks like mood swing, to the negative part of it. Not mood swing when you are elated, when you are excited. And it is because of this sudden change in the physiology, in the biochemistry of the woman. Hormonal changes, assuming a new role from being a pregnant woman to motherhood. Probably the absence of a spouse. Probably a spouse may even be present but absent psychologically. That sudden change in the level of her female hormones, pushing her back gradually back to pre-pregnancy status. As a man, as family members, as in-laws, when a woman just delivers, in the midst of congratulating her, in the midst of caring for her babies, we also need to pay attention to her psychological health. As a pregnant woman, as a new mom, you also need to pay attention to your psychological health. Tell us how you feel. Let us know how you feel so that we can help you. You feel weepy, you feel teary, some degree of disconnection from your newborn baby that you should be excited about. Let us know. Postpartum depression will need to be handled by specialists in that regard, gynecologists, or even mental health specialists. Maternal blues, otherwise called baby blues, is something that with time will just fade off in a few days to maximum 1 week. But if it is passing 1 week, the detachment, emotional detachment to your baby persists. You are crying, you are weeping for no known reason, you are not eating, you cannot sleep well, you cannot concentrate well. You will also need to see your doctor. It's not enough to get pregnant. It's not enough to sustain pregnancy. It is not enough to deliver your baby. What we want is that you are alive and well to take care of your baby, who should also be alive and well. Cheers to every woman out there. I would see you in the next video.